My question was, how will you confirm your diagnosis? By tissue diagnosis. You can definitively diagnose a lump, biopsy of the lump. What type of biopsy? What are types of biopsy? Start with minimally invasive. What's that? FNAC. Then core cut biopsy. Okay, so 5-needle aspiration cytology. Number 2, core cut biopsy. Number 3, open biopsy, which includes incisional biopsy and excisional biopsy. Incision means you incise a part of lump. Okay, and excisional means you take the whole lump out and send for histopathology. And the report comes to be invasive ductal carcinoma. What next? Invasive ductal carcinoma. For every malignant disease, when the diagnosis is established, the next step is stage the disease. And how you can stage the disease? By doing staging investigations. CF breast metastasis to liver, lungs, bone, brain. Won't you check these organs for metastasis? Okay, what will you do for liver? Simple. LFTs. Number 2, liver variant. Ultrasound, simple, easy, available. Ultrasound. LFTs and ultrasound will give enough information. What will you do for chest? Lungs. Chest X-ray. And if ultrasound or chest X-ray shows a suspicious lesion which is not clear, then what? Suspicious lesion in the lungs and in the liver. What will you do to exactly know what that lump is? Lesion is CECT. By that you will come to know that there are lung mets or not, there are liver mets or not. What do you do for bones? X-ray, skeletal survey, X-ray lumbosacral spine, long bones, okay, or bone scan. Okay. So for lungs, chest X-ray and CT chest. For liver, LFTs, ultrasound, CT scan. For bones, X-rays and bone scan. These are staging investigations. Now you have to stage the disease. How will you stage the disease? According to which classification? T and M classification. What is that? T stands for N. Lymph node metastasis. M. Metastasis. What are categories of T in case of breast carcinoma? What is T1? Less than 2 centimeters. What is T2? 2 to 5 centimeters. What is T3? 2 to 5 centimeters. What is T3? More than 5 centimeters. What is T4? Invasion to the chest wall, pec major, ribs, intercostal muscles. Superficially, skin. So T4 is skin involvement or chest wall involvement, right? T1, 2, 3, you've got an idea. T4 is invasion of chest wall or skin. What is N1? N1 is ipsilateral mobile lymph nodes. N2 ipsilateral fixed lymph nodes. N3 is either supraclavicular lymph node, supraclavicular lymph nodes, or internal mammary lymph nodes. So that is N3. Some classification. that is N3 is referred to as M1. And what is M1? What is M0?
No
No metastasis. What is M1?
metastasis.
Metastasis. So you have done TNM staging of the disease. Now there are staging groups. According to the sizes, there are staging groups. For example, T1, N1, M0, and so on. Size may change, lymph node status may change, M status may change, and groups, there may be multiple groups. Stages are 4 stages. Stage 1, stage 2, stage 3, stage 4. What do you think stage 4 will be? In any malignancy, when you refer that this is a stage 4 disease, what do you mean by that? Metastasis. And stage 4 means metastasis. The disease is metastasized, it's a widespread disease. So stage 4 is metastasis, right? Now, what is stage 3 disease? Generally, stage 3 disease has T4. Is it difficult to diagnose? If muscles or chest wall or skin is involved, then T is
T4.
T4, and stage will be
Stage 3.
not the part. Rest stages are stage 1 and stage 2, where there is no skin involvement, no chest wall involvement. Is it clear? So we have got 3 groups of diseases, 3 groups of carcinoma breast, 3 groups of invasive ductal carcinoma. Which one? Number 1, stage 4, where there are metastasis. Stage 3, where there is
Chest
wall or skin involvement, and rest stage, rest of the disease. So when there is no involvement of chest or skin, and before that stage, there are two stages, stage 1 and stage 2. Clear up till now? Stage 1 and stage 2 are called early breast cancer, EBC. Stage 1 and stage 2 is called early breast cancer. Stage 3 is called locally advanced breast cancer, because it has spread to local structures, above to the skin, below to the chest wall. Clear? Clear?
Yes, sir.
So, stage 3 disease is locally advanced breast cancer, and stage 4 is advanced breast cancer. Okay. Now, what do you think? Breast cancer is a systemic disease or local disease? It's a systemic disease. Very good. From the very outset, it's a systemic disease with local manifestations, or local disease with systemic manifestations. So when there is a systemic disease with local effect, treatment modalities and options should be like what?
Systemic.
There should be a systemic treatment and there should be a local treatment, right? Clear?
Yes.
So carcinoma breast should have a local treatment, local control, as well as systemic control. Okay, what do you think is the options for local control of disease? Number 1, surgery. Number 2, radiotherapy directly to the chest wall or breast. So local control is achieved by surgery and radiotherapy. How will you control the disease systemically? Chemotherapy and hormonal therapy. Very good. Up till now we have discussed that this is because of hormonal manipulation And if the receptors are positive on the pathology report, then hormonal therapy. The breast cancer is treated by a multidisciplinary team, including pathologists, radiologists, surgeons, oncologists. So, treatment is devised according to the stage of disease. And the consensus is that EBC, early breast cancer treatment, is surgery followed by chemoradiation plus minus hormones. Yeah?
Surgery
Followed by chemoradiation plus minus hormones. And next group of disease, what is that group? Locally advanced breast disease. But before that, tell me, what is principles of oncological surgery?
Completely remove the malignant.
Exactly. To completely remove the malignant lump. By what do you mean by complete removal? Meaning some of the normal tissue, rim of a normal tissue. When you take a rim of normal tissue, then the margin you have left behind, do they have tumor? No. So the objective of oncological surgery is, the principle of oncological surgery is to achieve tumor free margins. Right? To achieve tumor free margins is your objective. Do you think in stage 3 locally advanced disease you can achieve tumor free margins?
No.
It's very difficult because it has invaded to skin or chest wall. Okay? What will you do? You downstage the disease. And you downstage the disease by doing what? By administering chemotherapy. Right? And the chemotherapy which is administered before surgery is called neoadjuvant chemotherapy. Chemotherapy before surgery is called neoadjuvant chemotherapy. So you give neoadjuvant chemotherapy, you shrink the size of tumor, it may lift up from the chest wall, the skin involvement may reduce, and the patient and the disease are amenable to surgery. And then you may be able to achieve tumor-free margins. So, in locally advanced disease, what you do? Neoadjuvant chemotherapy followed by surgery, followed by chemotherapy or hormonal therapy or radiotherapy. Right? Next group. Advanced disease. What do you do in advanced disease of any cancer? Palliative treatment. Palliative treatment, symptomatic treatment. If there is bone pain, radiation. If there is fungating mass, simple mastectomy. You do not treat the patient with curative intent. You do not cure the disease. You have palliative intent. You just treat the symptoms of the patient. So this is the treatment. Right? Now, surgery. When we said surgery, so what is surgery in breast cancer? Surgery. Modified radical mastectomy. Okay? Modified radical mastectomy means what? Okay, two components of surgery. What modified radical mastectomy means two things. One, mastectomy, two, axillary clearance. M means mastectomy, axillary clearance. What do you mean by mastectomy? Removal of complete breast tissue. One. Number two, removal of all involved skin. Number three, removal of nipple areola complex. Surgery has two components. mastectomy and axillary clearance. Mastectomy has three components: removal of whole breast tissue, removal of involved skin, removal of nipple areola complex. Axillary clearance is of three types: level 1 axillary clearance, level 2 axillary clearance, and level 3 axillary clearance. Clearance of what? Lymph nodes. And what are levels of lymph nodes? So when lymph nodes are lateral to pectoral minor, this is level 1. Lateral to pectoral minor. When removal of these lymph nodes is done, that is level 1 axillary dissection. Level 2 lymph nodes are behind the pec minor. And level 3 lymph nodes are medial to pec minor, maybe supraclavicular. What are level 1 lymph nodes? Lateral to pec minor. What are level 2 lymph nodes? What are level 3 lymph nodes? So, the studies has proved that doing level 3 dissection has no overall survival benefit to the patient. Meaning, dissection is extensive, it can have more harm than benefit, and it does not prolong life of the patient. So, MRM means mastectomy plus level 2 node clearance, level 2 axillary lymph node clearance.